Well, so you see a picture of yourself on social media and you think, wow, look at that double chin. It bothers a lot of men and women, and now they're turning to a fat-dissolving acid called Kybella. You may have seen the commercials. Joining us on the Kogo News Live Line, board-certified plastic surgeon, Dr. Farah. Good morning, doctor.
Good morning.
So tell us about Kybella.
Sure. So Kybella is deoxycholic acid, which is an acid that is normally found in your body. It normally digests fat. And they've been able to purify it, and the FDA has approved it for injection into the submental fat, or what we call the chin fat, to help dissolve away that fat.
So what are the side effects, and how long does it last?
Not really any side effects. You do get a little bit of swelling, and you will have a little bit of bruising for a couple of days. The interesting thing about Kybella is that it should be permanent, because once you dissolve the fat isn't there anymore. So it isn't like Botox or fillers, which are things that you need to maintain every couple of months. Typically with Kybella, a patient needs about 3 sessions spaced 6 weeks apart, but after that, they should be done.
Is it painful? A lot of people want to know because they hate needles.
It really isn't that painful. It is an acid, so typically afterwards, the injection itself isn't painful, but afterwards you may feel kind of a burning sensation, and that could last, 20, 30 minutes. But typically after that, it's done.
All right, now we mentioned, social media, Facebook, Twitter, Instagram. Everybody's taking these pictures. Is social media creating unhealthy body image issues for men and women?
Well, I think social media is definitely creating more awareness of how people look, and I think taking selfies has become a lot more popular, and people just know, they're more cognizant of how they appear and want to really put their best face forward, and so they are turning more towards Kybella or Botox or fillers or whatever to kind of put their best photo forward.
But these treatments aren't cheap. I mean, Kybella, how much would it be for, you said 3 treatments? How much would that be?
Yes, sir. So each vial is about $600, and it depends on how many vials you need for each treatment. Typically, most patients need 1 to 2. So I guess it can range anywhere from $1,800 to about $3,600.
And for some people, that's worth it, right?
Exactly.
And for Botox and things that people have been getting, and that you said that has to be maintained. So that is, if that's part of your routine, that's going to be a big part of your budget.
Exactly. So, the interesting thing about this is the only alternative that we as plastic surgeons can offer is liposuction. And liposuction obviously is a lot more expensive. There's a lot more downtime, and it's an invasive surgery. So this is an interesting option in that it has very little downtime. It's relatively more affordable than surgery, and the results are just as good.
Well, and speaking of surgery, are you still seeing as many facelifts, or are people now going for more of the fillers and the Kybella?
Yeah, I think we've seen a trend that people are now going more towards the non-invasive options. We just have better tools at our disposal, so we can kind of almost do like a liquid facelift with Botox and fillers and Kybella, and then with the use of radiofrequency, we can tighten the skin. So a lot more people are now opting for these procedures because, again, the downtime isn't as much, and overall, it isn't as expensive.
All right, doctor, thank you for your time. That is board-certified plastic surgeon, Dr. Farah, joining us on the Kogo News Live Line.